I work with Christos Muguerza. What I do, I'm in charge of the non-acute division, and also in charge of one hospital in Mexico, in Saltillo, the city of Saltillo. I'm part of Christos Muguerza, as I already said, and we are part of Christos Health system in Texas. Our Christos Muguerza Hospital started about 70 years ago in the city of Monterrey, and about 7 years ago we joined venture with Christos Health. So right now we right now have 3 hospitals in Monterrey, one in Saltillo, one in Chihuahua, and we are building right now one in Reynosa. It will be open about March. So our strategy is to open one hospital per year in Mexico. So we are aiming to be the leader of Christos, the leader of healthcare in Mexico, of private healthcare in Mexico. Our growth is from 7 years from now has been like very big because with this joint venture, our strategy is becoming to attend patients not only from Mexico but from abroad. Okay, the strategy of building Reynosa is to continue and build other hospitals in all the border, so we can get patients from the U.S. We already have patients from the States. We have patients in the kind of normal procedures of like bariatric surgery and plastic surgery mostly right now. These patients are out-of-pocket patients that arrive to Mexico. They look for a doctor there, and they will pay for the procedure. What we are doing right now is trying to bring patients on orthopedics and cardiology also, and also with general surgery, elective surgery, such as cholecystectomies, all the procedures that can become elective. Okay, and that will be an option for the American people. And also what is happening here is that they are looking for quality mostly, and then for price. Christos Health brand is well known in the southern part of the U.S. There have about 40 hospitals and $4 billion in assets. So they're very well known also for their quality. And another advantage we have here is that we are very close to the border. So many Americans could go by to Monterrey in a short flight. I mean, short flight compared to the other side of the world. In 3 hours you can be in Mexico or in Monterrey from any city in the U.S. And we have connections with the most important cities of the U.S. New York, Dallas, Chicago, Los Angeles, Houston. And we are very available. So I think we have an advantage here. Also, our hospital is the only JCI accredited hospital in all Mexico, and the first one. So I think that there's a great achievement because we were working for 3 or 4 years to obtain this certification or this accreditation. Now we have it in the high specialty hospital in Monterrey, which is one big 180-bed hospital, and that's what we're aiming for. We're trying to bring patients to this hospital and to ensure quality, to make them feel comfortable and trust us that we are doing very good medicine. I think that the savings will go from 40 to 50% savings, real savings. I mean, why? Because I can probably in some cases can go up to 70%, but most of the cases will go in an average of 40 to 50%. First of all, the patients is our only objective, to make the patients feel comfortable and to satisfy their necessities in the healthcare procedure. Okay, so that's our goal. The only way to achieve it is to give them the best quality we can acquire. We have the College of American Pathology and Laboratory. We have, as I already said, the JCI, which is it's a great achievement for us and for Mexico and for Mexicans, because we are raise the standards of quality in Mexico by doing this. People are calling us from other hospitals to assess them in how we do it, because no one has it. So I think quality is the way to go. We are near to the U.S. Geographically, we have a very good position. And the U.S. is having a lot of problems with the health care cost of the baby boomers, the people who are retired right now. They are looking for a smaller cost and a very good quality. And probably this will be the driver to, in some kind of way, the insurance companies will look for a solution, or the TPAs companies will will search for a solution, look for a solution, and this is part of that solution. It's not that you will not solve this problem at all, but it's one part of it. So, and this is growing. It's just about you will need health sooner or later, and you will search for the better option. So we have to continue in our way of making good quality, and to show them what we do very well in Mexico in our services.